a dedicated hospital pharmacist currently serving as the pharmacy outreach specialist and clinical instructor for the University of Colorado Skaggs School of Pharmacy. And there's a whole lot of other information that I think she's going to cover during
Yes.
her talk. So help me introduce Dr. Chandler.
Thank you. Yes. All right, let's see if this works. Can everyone hear me okay in the back? Thanks, Brian. And online, hello, online folks. Thank you all for this opportunity. My name is Dr. Chandler Follett. Please call me Chandler. And today we'll be talking about bridging cultures and breaking barriers. So what is your role in having more inclusive healthcare with a global pharmacy perspective? Let me make sure I know what I'm doing technology-wise. All right, so all of you now have a note card in front of you, and online folks, you do not have a note card, but go ahead and pull up a Word document or start writing this in the chat. So what I want you to do is I want you to think about a time when you, a friend, or a patient faced a healthcare challenge because of a cultural difference, a language barrier, or a lack of access to resources. And just one or two sentences, it can even be bullet points. Just go ahead and put that on that first note card. And don't put any names or identifiers of any form, just write that information on the card. And we're gonna do like a Yankee swap. If you're online, please do the same thing, but put it in your chat, but don't push submit. We will then have a way in which for you to exchange the information in a similar way. So I'll give you a few moments here. Need some hold music. And if you don't have a pen, looks like everyone does, but there's pens over here. And if you don't like your pen, these are actually amazing pens. There are branded pens, but feel free to grab one on the way out. Definitely, I'm a pen girl, so I highly recommend these. Cool. So if you are online, what you're going to do is in that chat area of the Zoom, just pick someone random and send your statement to that person. And then the random statement you receive, I want you to copy it and then send it to someone else random. So you're not sending it to the group, you're just sending it to 3 random humans in the chat. I think there's about 15 of you online, so this should work out decently well. If you receive a lot, good luck. It's a task. Oh, they can't chat on Zoom. Sorry, ignore that. Apparently you can't chat with each other on Zoom. So instead, hang out in your thoughts, maybe develop your idea of what you think is considered a healthcare challenge because of cultural differences, language barriers, or lack of access to resources. And then you'll have the opportunity to share if you'd like. Now in the room, I know you all just received some sugar, but I also am holding you away from lunch. So what I'm gonna have you do to keep this moving and active is stand up and walk around the room, and you're gonna pass your card to one person, receive that card from them, pass it around to 2 other people, right? So you're gonna do somewhat of an exchange so that you're not with your card and you have someone else's card. So do it. And if you can't move around, pass your card in another fashion. Keep passing, keep passing. You can switch multiple times, switch multiple times. Cool. Great. Okay, and look at your card, assess your card, and if you think you have a good example of one of the following, go ahead and raise your hand and tell us what it says. Don't be shy. We're all going to be friends at some point. Yes, go ahead. Okay, so she said, for those of you online, the patient spoke a really rare African dialect, so interpreters were difficult to find, and it was hard essentially to provide care to this patient. Great. Someone else. Yes, Lori. Did an over the phone medrec with someone that did not speak English. Something I'm sure you can all probably relate to. Any other ones? Yes. Great. So older patient with dementia, trying to understand how to best provide care to someone who maybe doesn't understand our traditional ways of providing care. Brian. Outpatient pharmacy, the patient was deaf. Yes, Isabella. Okay. How to counsel a patient who didn't speak English and was translating through their 4-year-old daughter. Any other ones? Yes. Marion. Got it. Patient needed an antihistamine. They came to the pharmacy window, didn't speak English, had to actually get another provider from the emergency room to come and try and translate for them. One of them online says, this is a very common theme right now. It seems to be different languages. Assisted customers who speak a different language by using their phone to decode the conversation. A Hispanic person came in, could not understand, son how to try and describe what they needed. This one was related to someone's mom who needed to get access to healthcare and dental care because she had lost her insurance and knew that the medical care was too expensive and didn't know there was potentially be programs to help her get the care she needed. So she was from the Philippines, right? So I wanted to get this conversation started because there's so many healthcare challenges that exist because of cultural differences, language barriers, and a lack of access to resources that you all are experiencing on a regular basis. So there's a lot of opportunity to not only learn from each other, but learn from certain experiences that hopefully I will detail to you today. I also wanted to say with this, pardon me? Yeah, I skipped it on purpose, I promise. I'm gonna be doing that more than once. I also wanted to say with this that you are the face and voice of pharmacy, right? When people think pharmacy, it's kind of like when they think about their physician. They're oftentimes not actually thinking about their physician. They're thinking about their nurse. When they're thinking about their dentist, they're not thinking about their dentist. They're thinking about the dental hygienist. I feel very passionately that when people think pharmacy, they're thinking of you. They're not thinking about the pharmacist. So you have a huge opportunity to bridge the barriers and help to bridge cultures and break barriers. I also want to give you 2 things to think about today beyond this presentation. One, because you are the face of pharmacy, your voice needs to be elevated. You're all here today, you're gaining additional education, and I think that's incredible, and I hope you continue to do so and that your employers support you in doing so. But I also want to encourage you to please join your state pharmacy organization. That is how you elevate your voice. That's how you improve your work environment. That's how you improve a situation that's maybe impacting patients on a regular basis. It's through legislation, through getting into those leadership opportunities, and having that larger voice with a community around you. I know in Colorado, we have a lot of support for pharmacy technicians to join, a lot of financial means to support you to do so, but I know not all of you are from Colorado. So please, please, please join your state organization. It's the best way that we as a profession can make positive changes to improve healthcare overall. The second thing I will say is this afternoon, you'll be hearing from Dr. Prescott. I don't personally know Dr. Prescott, but I do know that he will be speaking to you about becoming a pharmacist. And a big part of what I do, I wear a lot of hats here at the School of Pharmacy, but one of which is educating on the pharmacy profession and encouraging people to consider becoming pharmacists. I was just at a conference last week in Washington, D.C., and it was amazing how many people were talking about you. And I was like, God, this is great. I'm gonna be talking to pharmacy technicians next week. But schools, organizations, Walgreens was represented at this conference. They want you to become pharmacists. Now, I'm not here to convince you to become a pharmacist. All I'm here to do is to tell you if for one moment in your life, you've sat there at work being like, I could do that. I want to do that. Or like, hey, this medication, when I was just listening to like how he was talking about it working or she talking about it working, that's really interesting to me. Or as when I was a kid, I used to like read bottles, and that's how I like became interested in medicine, right? And I was like, how is this working? Like, how is this pill going into my body and having this impact or this effect? If that is you in any capacity, please consider going to pharmacy school. I tell you that because right now, marketing teams, recruiting teams, entire universities are targeting you. And so if you want to go, there is a lot of support and there's a lot of financial support. If you don't have the prereqs, even Walgreens right now is paying pharmacy technicians to get their prerequisite courses online for free. So there's my two spiel, also doing my job through CU. All right, now let's talk about what's fun. So objectives for today: recognize the impact of cultural competency on patient care. Cultural competency is something we'll dive more into detail with, but cultural competency to me is kind of like when you talk about emotional intelligence. I don't know, when you're speaking about your friends or if you're in the dating world talking about, are they emotionally intelligent? I think we now have to be in a world of cultural intelligence, right? So how do we become more culturally intelligent, especially when it comes to patient care? Understand how to effectively support underserved communities. We are in a world that is changing so much, our country is changing so much, and it's really important that we as pharmacy learns to support underserved communities. And explore global pharmacy perspectives and opportunities for you to get involved. When I say global pharmacy perspective, I literally mean the perspective part of global pharmacy. So having a global pharmacy perspective, regardless of if you're working here, if you're working in Alabama, or if you have the opportunity to work somewhere outside the United States. All right. So let's talk about something that's really fun to me. Guatemala. I have a huge passion for working with underserved communities. When I chose pharmacy, one of the main reasons why I did choose pharmacy was because there wasn't a lot of work from what I saw with pharmacists working in underserved communities, especially abroad. I speak Spanish, that's my second language, learned. I didn't grow up speaking Spanish. I'm from Texas, probably should have. And I just always had this passion for working with low to middle income countries, with underserved communities, and I wanted to get involved. This picture is actually 10 years ago. I know, still look the same. Should have worn the same scrubs. But in pharmacy school in my 4th year, I had the opportunity to establish a pharmacy rotation in a clinic in very rural Guatemala. It's actually located kind of about 6 hours away from Guatemala City by car. If you get car sick, don't recommend this. And the clinic is in collaboration with Agro-America, which is the largest grower, distributor, shipper of bananas in Latin America. And this clinic was established to essentially serve the workers on the banana plantation and the community around it. So this was a really eye-opening opportunity for me. Because I went in saying, man, I'm like almost done with my PharmD. I know all these things about drugs. Like I am going to help. Like we all have this great intention of helping. And I went in and like the first week, I don't think I spoke, which is, if anyone knows me in this room, is very uncommon because I was in shock. Like I was in absolute shock seeing how different pharmacy was in Guatemala. To put that in perspective, so the girl in white, her name's Carolina, amazing human being, and her job is to work in the pharmacy, her full-time job. And she has, at the time, had no pharmacy training. Let that sit for a second. No pharmacy training, and she is the only one working in the pharmacy. Crazy, right? On top of that, the lady in black, her name's Monica, incredible also. She is literally like this tall. Like you can see me, I'm like, and I'm not very, vertically inclined. She's tiny, but she's the pharmacist, right? And in Guatemala, she is allowed to own up to 8 pharmacies, and she's only required to visit that pharmacy once a month. One more layer, get ready. You in Guatemala and in most of Central America can access any medication other than controls by walking up to that pharmacy and saying, I want A through Z. No pharmacy training, no pharmacists on staff, and the community is capable of buying whatever they want in whatever form, number they want, whatever dose they want, etc. So you can imagine this was a bit shocking for me. Coming from the United States of America, where everything's so formal, everything's so strict. Like, what do you mean you're coming up and asking me for, to inject your baby with a steroid with a glass ampule? Like, what are you talking about? So it was a lot for me to see, but it opened my eyes to how different pharmacy is abroad, right? And I had the opportunity, actually 3 weeks ago, to go back to this clinic. It changed my life in so many ways 10 years ago. Full circle story. I went away, I started working, and now I've come back to CU. And now I lead this rotation for pharmacy students. So we were reestablishing the relationships because it kind of died. Not the people, but our relationship with the clinic. And so I wanted to go back and kind of see how things were going. And I'm really grateful I did because it helped me kind of reframe when it came to this presentation. Because Carolina, as amazing as she is, and someone who I stayed in contact with, she went to nursing school and I knew that, and now she's a nurse. What does that mean? The pharmacy now has a new human being working in the pharmacy with no pharmacy training, who's never going to probably have any pharmacy training unless it's provided potentially by me. And we kind of started all over, which Central America, right? Like that is, they have more training there than they would in any other clinic because a lot of or any other pharmacy, because typically you're like gas stations will have a pharmacy, or you're driving down the road, you're buying a Coke, you can also buy some, antibiotics, really wherever you want, you can, because there's no regulation, right? But what I wanted to say with this is that when it came to the interventions that were made, right? Like I invested so much training in Carolina, but she went to nursing school. But the things that still remain today, the things that she passed on to the girl that was in between her and now to the guy that's in there today, were a lot related to the things that I had learned as a pharmacy technician. It was processes, right? Like, let's establish a dispensing area to have this be safe and clean when someone's coming in asking you for a medication. Let's identify ways to improve how your inventory is organized so that you can better access it when someone is coming and asking you for medications. Let's understand the concept of medication safety, and maybe when a patient's coming to receive an antibiotic, and you have the capacity right then and there to compound that antibiotic, how do we have those conversations to help the patient say this is the safer option for me? So it was things like that that you all are doing all the time, ensuring that an antibiotic has a dispensing device, right? Like when I talked to the new technician, these were the things that he knew. He didn't know what any of the meds were for. He didn't know what would be considered like an opportunity to triage a patient to the clinic. He just knew basically this is where I dispense. Like this is the type of conversation I can have to potentially make sure that the community is safe when they're receiving the medications that they're asking me for. So I think that's an important thing to start off with, because it shows not only the opportunities to improve pharmacy care internationally, but it also gives you a small tidbit of potentially what your patients, their idea of pharmacy is when they're coming to see you, if they're coming from a country in Central or South America. So that leads me into this idea of global pharmacy perspective, right? When I say global pharmacy perspective, we all live now in the United States of America, but our country is a blend of the world, just like we talked about with some of these examples, right? A lot of patients coming to you don't speak English. It's not their first language. They're probably coming from somewhere else, right? Without looking it up. How many countries are in the world? Don't worry, I had to look this up too. I hear 121, I hear 150. 200, 191. Okay, we're getting warmer. 197. So you have the opportunity when your patient comes up to you that they could be from 196 other countries, right? Having a global pharmacy perspective enables you to serve those patients better. Even if you have never traveled outside the United States or worked outside the United States, just starting those conversations with a mentality of, I'm going to approach this person with a global pharmacy perspective enables you to provide a higher level of care. So we talked about Guatemala, very low income country, low to middle income country, especially where we were. I mean, I had to like check my bed for scorpions every night because it's like pretty rough there. But now let's talk about a more developed country. Let's talk about Germany. I had the opportunity to work in Germany in an independent pharmacy there, and also mind-blowing, but in a very different way. So actually in Germany, the idea of automatic or long-term medications is not a concept that's well received. No, let me rephrase this. To refill a medication is not common practice in Germany. In general, if a prescription is written, it's for a short amount of time, or potentially, like if it's something like birth control, they're receiving 3 months. They're not receiving that 11-month prescription that we're all like, good heavens, why are we doing this for a year? Or 6 months, like, or they're on it for the rest of their life. That is not how the Germans think. They are very efficient people. They want to take a med and they want to be done. And if they need more, they want to talk to their doctor. Part one, that's different. Part two, that y'all are probably going to fall out of your chair because I nearly did. Everything, maybe not everything, but let's just say 90% of medications in that retail pharmacy, at least the one I worked in, almost 100%, come directly from the manufacturer in pre-packed boxes. Oh, I see you nodding. Yes. Let me say that again. Instead of those massive bottles of amoxicillin that you're like dumping in to count out 16 of them, everything is pre-packed. Like your Sudafed, like your Mucinex, everything. Crazy, right? I was like, what are we doing here? Like, this is insane. This is insane. So incredible, right? Like, you speak German, I highly recommend you go work over there because that enables you to have a relationship with your patient. It enables you to have those conversations with your patient because you're not there calling insurance. Oh, because by the way, they only have like public versus private. So it's either gonna be like €5 or €10 like every time. So you're not dealing with the insurance. You're not counting out pills. None of that BS. You're essentially getting the prescription, having the conversation, creating that relationship, right? So I give you that perspective because you potentially could have a German that walks up to your pharmacy. Maybe they're here on vacation. Maybe they just moved here. They're going to be like, I'm sorry. What the hell? Why am I waiting 20 minutes, 30 minutes when like I gave you my prescription? You're supposed to give it back. Like, go grab the box. Maybe we have a conversation and I leave, right? So very different system. And I say that because pharmacy laws and practices vary drastically around the world. And it's so important that we approach everyone now, especially today when we're living in a country filled with people from all over the world. We think about where that person's coming from. We think about how they might have experienced pharmacy in their home country and what they're going to be experiencing when they're coming to your pharmacy, because it's going to be very different. All right, let's continue down this journey of Chandler's pharmacy life. So after I graduated from pharmacy school, I was like, I'm gonna go save the world, get my master of public health, work for the WHO. And then I saw my loans. That did not happen. My parents were like, you are not going to more school. And I'm like, you're right, I am not. So I had the amazing opportunity actually to take a job right here in Pueblo, Colorado, Southern Colorado. How many people are from Colorado in the room? Oh, wow. Wow. Okay. I thought it was gonna be way more. Welcome to Colorado, beautiful state. I can give you all kinds of hiking recommendations if you're here a while. So anyways, okay, so I took a job in Pueblo, Colorado at a massive hospital down there. And I tell you this story because I was so keen on working in an international environment. I was so determined to like go back to Central America and keep working there. But let me tell you a little bit about Pueblo. Pueblo is essentially, in so many ways, representing an area of extreme poverty. There's significant socioeconomic issues, healthcare challenges, and it's highly characteristic of an underserved community. There's unfortunately a lot of poverty, geographic isolation, and workforce shortages. To put that in perspective numerically, about 80% of the patients that were admitted to Parkview Medical Center, which is where I worked, do not have or are covered by Medicare, Medicaid, or uninsured. So they were heavily relying on safety net services at this hospital. Really, really, really interesting population to first serve, right? Because people are very, very sick, but they essentially don't have the resources to continue on with care. So this was literally, I mean, Pueblo, right now we're in Denver, obviously. Pueblo is about 3 hours south, and I felt like I was back in Guatemala. Maybe not to that extreme, but like in terms of the patient population, not having English be their first language, maybe not being able to fill their medications because they can't afford it. Dealing with a lot of things like issues with access to quality nutrition and exercise, because this is an area burdened by, a lot of work and family needs. I mean, it's an area of Colorado that really struggles. So everything that I was trying to achieve by working internationally was actually right in our backyard, in my backyard. That cultural difference, that language barrier, the lack of access to resources. So what did we have to do? Maintain that global pharmacy perspective. Think about where the individuals were coming from when they were coming to the pharmacy, or when we were doing maybe a meds to beds or trying to get their home meds right, and try and understand and take those extra steps to support them like you all do every day in your job. But when I was in Pueblo, it wasn't all well and good, especially initially. I actually struggled a lot, feeling like these big dreams that I had were being crushed, and I didn't know really what it was going to lead to after that. But I really tried to stay steady with, okay, this is a population that I can really support. I was learning a lot because the patients were really, really sick. And I had the fortunate opportunity to, learn a lot of things. One, I didn't have to work abroad to serve an underserved population. I also had a really great technician who I worked with. His name was Chris Racine, and one day he found me outside. They called me Sunshine because I do whatever it takes to be outside. And I was having a down day, and I'm like, Chris, what am I doing in Pueblo? This was not the plan. I want to go save the world. And he was like, listen, Chandler, to impact the world, you must start with your community. Your impact on your community then impacts your city, your state, your nation, and your world. Right? I was like, heck yeah, Chris, that's right. And he was so right. I really think of it now as we have a big lake, every little impact that you all make, whether it's taking the time to get a translator to speak to someone, or working to understand maybe why someone can't afford a medication and what resources are available to them. Like maybe one thing feels like a pebble you're throwing into a steel lake, but it's still making ripples, right? Maybe something else feels like you're throwing like a bigger stone and it's making bigger ripples, right? And then sometimes you do things you're like, that was a boulder. I freaking made that lake rock, right? And that is what you have to do, right? We all have an opportunity in pharmacy and healthcare, even just in your everyday life, to really impact people who then have a ripple effect on your city, your community, your state, your nation, and your world. So I hope you don't ever forget that, because I think it's so impactful and motivating for your everyday life. Now, Judy probably is like, are you going to ever give them anything phrase-wise? Definitions. So here are some terms. I had to give you something. So what is global healthcare? Global healthcare is the collaborative effort to improve health outcomes, achieve health equity for people worldwide by addressing health issues that cross national boundaries. This is different from inclusive healthcare. Inclusive healthcare is the practice of providing equitable, respectful, culturally competent health services that are accessible and tailored to meet the diverse needs of all individuals, regardless of their background, identity, or ability. So again, meeting people where they are, understanding who they are, and working with them to help them get the care that they need, whether that means they're from Central America or Europe, or they're right from Pueblo, Colorado. Sometimes it's just taking that extra step to help that patient get the care that they need. Great. So at this point, I hope you are gaining a little bit of an idea of how you can have that global pharmacy mentality when it comes to your role within healthcare. And I hope you also know that the point of this conversation or point of this lecture is not to say like, oh, go abroad, right? Actually, the point of this is to say, serve your patients here, right? And here are ways that you can better serve patients here today, when, again, we're coming from 197 countries. That is something that our patients today are representing. They're representing 197 countries, cultures, religions, pharmacy structures, laws, insurances, all those. So there's a lot of ways that you can, support them in your everyday job. So the WHO, and this is from 2019, but WHO, it takes a while for them to come out with new ones. But this is what they said are the top 10 most significant threats to global health: air pollution and climate change, non-communicable diseases. So that's like your that's like your diabetes, your hypertension, your chronic diseases. Global influenza pandemic, way to go, WHO, you nailed it in 2019. We all know what happened after that. Fragile and vulnerable settings. So these are like settings affected by conflict, drought, famine, displacement, and as a result, they have weak healthcare systems. Antimicrobial resistance, huge. Ebola and other high threat pathogens. Weak primary healthcare, which at this point, I'm almost thinking that we sometimes have a weak primary healthcare just due to access, right? A lot of people can't access their primary health provider. Vaccine hesitancy, you all saw this through the COVID pandemic. Dengue, this is a mosquito-borne illness, and HIV. So top 10 right here. And when I look at this list, I see so much opportunity for pharmacy. Non-communicable diseases, this is huge. Global influenza pandemic. We as a community, we as a profession, massively positively impacted our patients during the global influenza pandemic. And we need to keep riding that wave, right? Like we need to keep pushing more for pharmacy and pharmacy services to be provided to our patients, because we have the capacity to really support, especially in a global pandemic situation. Antimicrobial resistance. This is a great one for us to help when it comes to education or helping to make sure patients have an understanding of their antibiotics, to make sure they know what they're taking it for and why they need to take it the whole time, or just having that conversation like this is for 7 days, right? Or finish this entire bottle. That helps decrease antimicrobial resistance, especially unfortunately because across the world, this is, especially in the low and middle income countries, antimicrobial resistance is shooting through the roof. So we need to really take ownership of this here in the States. Weak primary healthcare. I think this is a huge opportunity too. We as a profession are the most accessible healthcare provider. We don't necessarily get paid to be the most successful healthcare provider, but we are the most accessible healthcare provider. And I think it's important that we take ownership for that because really related to the weak primary healthcare, I don't know if any of y'all have tried to call your doctor and get into an appointment, but it's like, yeah, how does January 2026 sound? And I'm like, wait a second. It's June? They're like, yeah, that's our first available. Or like, I don't know, basic dermatology. They're also like 6 months out. 6 months out. So why do you think people are depending so heavily on an emergency room services, right? Because what else are they going to do? They can't get it. Sometimes you can't even get established with a primary health care provider, right? Like I've seen a lot of nods. They're like, we're not taking any patients. And I'm like, so what are you doing? Right? So as pharmacy, we have a huge opportunity to be that accessible resource, that trusted resource to support our patients when they can't get into a doctor. Because, little side note, I unfortunately ended up in the emergency room about a month ago. And when I received my bill, I nearly died. Like, I was like, I'm young. Are y'all trying to kill me? Like, I thought the purpose of the emergency room was not to get killed, but like $30,000 basically to go. And I mean, I didn't even stay for very long. I'm like, this nicest hotel I've ever stayed at. But $30,000, and that's what our patients are dealing with, right? They're like, I can't get into my primary care, so I'm not getting seen. This issue is lingering. It's getting worse. It's getting worse. And then eventually they're like, I don't have any other options, so they walk into the emergency room. And then $10,000 later, they're like, well, shit, I shouldn't have done that. I would just rather die. So I really, really, really strongly believe that because the system is falling right now in the States, pharmacy needs to rise and we need to be that first line because a lot of the things that we do within pharmacy can prevent that emergency room visit. Vaccine hesitancy, this is huge. We'll talk about it a little bit on this next slide. So, too many slides. Okay, medication access and supply chain. So when I kind of break down those top 10s, these are like 4 I think that we can focus on as a pharmacy community. Medication access and supply chains. This is y'all's bread and butter. Like, you know how to get meds. You know how to get them quickly. You know which ones to order, what quantity, etc. And I think having a medication ready and available for patients when they are ready for that medication is one of the best things that we can do. Because we're working with patients who are managing their lives, right? And maybe they like found 30 minutes to run to the pharmacy and that's the only time they're gonna have this week because they're taking care of a sick family member. So making sure that we're doing our job to ensure that medications are readily available and that we're controlling things when supplies go down. Vaccine, disease prevention and vaccination. So again, like I said, the COVID pandemic really showed how effective you all are with vaccine management. And the most important thing with vaccines is that the person gets it, right? Because if they get a vaccine, then they're less likely to get the disease state that would potentially put them on an antibiotic. So it's all interconnected, right? We're trying to prevent those long-term disease states that would then put someone on medications, potentially antibiotics, that would lead to antibiotic resistance. So it's all connected with ensuring patients are getting vaccinations to prevent diseases. But in order to do so, pharmacy has to be seen as a trusted resource when it comes to healthcare. So continuing to be that face, continuing to be that resource that people feel safe and comfortable coming to so that they're willing to receive that information from you about vaccines and prevent long-term ailments. Chronic disease management. Again, this is your diabetes, heart disease, mental health conditions. This is actually responsible for the most deaths worldwide, and it's oftentimes due to lack of access to care and lack of access to those medications. So what you can do is help manage the conditions through reinforcing adherence. You know, if you have a patient that you see regularly that you know has diabetes and they haven't picked up their insulin, you know, picking up the phone and calling and saying, hey, what's going on? Let's make sure that you're getting this, because that leads to long-term effects, right? If someone's diabetes isn't managed, it can lead to way worse downstream effects. So making sure we're staying on the front end of chronic disease management. Language barriers. We have definitely talked about this just through y'all's examples. I would say language is likely the #1 barrier to someone receiving quality healthcare. So they actually say when it comes to working with someone that is not speaking, you know, English as their first language or whatever language you're speaking at the time, really trying to take the time to get a translator available and not depending on necessarily a family member to do the translation. It just shows like a commitment to that person, commitment to their care, that they can 100% receive the information that is necessary through their language. And a huge thing, you know, I experienced in Guatemala specifically is a lot of patients couldn't read. So not only if they did go through the clinic, they would receive a prescription, they would come to the pharmacy and with the paper, and we would like grab, you know, whatever med, and you basically would give it to them there. You don't even create a label. You're just like, okay, here's your 10 amoxicillin and here's back your prescription, like have a nice day. But if they can't read the prescription, how are they going to know how to take the med, right? And we see that too here in the States. Like maybe they can't read. Maybe it's in English and they can perfectly read in Spanish, but they can't read in English. So what do we do to get creative to make sure patients understand how to take their medications? In Guatemala, we basically came up with a labeling system, again, fully based off of my time as a technician, to have pictures depicting like a sun and a moon, or like with food. And that's when we identified someone had low health literacy, did not have the capacity to read. We essentially would label their medications that way so that they would go home feeling confident and capable of taking and managing their medications. Asking those open-ended questions too. This is something that I think is really helpful with language barriers is having the conversation go both ways, right? So making sure you're asking open-ended questions like, how did your doctor tell you to take this? Or yeah, I say how is one way. And then also doing the teach back method, right? So if you are explaining something, for example, you just explained to someone that they'll be taking their antibiotic for 7 days, like you can say something to the effect of, I know I just told you, like I just explained, you know, how to take this antibiotic just to make sure I didn't miss anything. Can you please tell me how you will be taking this antibiotic, right? So it's like you're putting the blame on like, I maybe didn't tell you anything, but really I'm just making sure you understand. So you're putting it back on yourself and then having them teach you back what they're going to do. So really effective way to make sure that the conversation goes both ways and that we're decreasing those language barriers. Great. Let's see. So let's quickly talk about cultural competency. Maybe not quickly, but cultural competency in pharmacy. So what is cultural competency? It is the ability to understand, respect, and work well with people from different backgrounds, beliefs, and cultures. It means being aware that everyone has unique experiences that shape how they think, communicate, and interact with healthcare, and adjusting your approach so that each person feels understood and supported. That's a big undertaking. That's why I like to call it cultural intelligence. A little bit easier, but you know, we all have to work on this cultural intelligence to be able to responsibly understand those around us, understand where that person's coming from, and make sure that we're providing care that is matching that level of cultural competency of the patient. So when I think about kind of numbers related to cultural competency, the U.S. Census Bureau did a survey. It was only until 2021, so it was 2017 to 2021, so it's definitely changed a bit now. But they said, what percentage of people living in the United States speak a language other than English at home? 22%. What percentage of people living in America have limited English proficiency? 8%. 14% of the US population say that they are foreign born, so not born in this country. There's hundreds of distinct religions, as we all know. And per this survey, 8% stated that they were uninsured. One of the other many pieces that I took away from my time at Parkview was we had the most incredible CEO. And obviously, you know, a big part of his job is managing like the finances and where we're always drowning. They were just bought by UC Health 2 years ago, so they're doing fine now. UC Health has to deal with that, but large company. But he used to always say, you get to, and then insert whatever there, right? Like you get to stand up and walk around, right? You get to serve this patient population is how I think about this, right? So you get to live in America and serve this really diverse population. And there's a lot of solutions that you can implement. There's a lot of skills that you can have to effectively do so. One, using clear language and interpreters. We talked a little bit about language. I think really having that back and forth dialogue is important, and using interpreters when you're experiencing patients who don't have high level of English abilities. Two, listening without judgment, right? We're quick. I mean, unfortunately, our patient population is quick to jump on us, right? How can we, you know, try and really take a pause and listen to them without judgment and try and understand where they're coming from and maybe why they don't understand that things are taking 20 minutes when in their home country it takes 2, right? And then helping people to feel safe, respected, and heard. I think that's really important as we become the primary health care location within pharmacy, like really making sure people want to come to us first, want to utilize our services first, and feel really confident doing so and having those questions answered if they have them. So let's do a quick case here. So this could either be here in America, or it could be in Central America. So you have an 18-year-old mother who approaches your pharmacy, requesting 3 tablets of amoxicillin, which is amoxicillin, for her child who is 1 year old. What do you do? They're on every corner now, right? Yeah, in this country you have to have a prescription. There's one right across the street. That's definitely a way you could respond. What else? What are you thinking about? Yes. Go ahead, Rhonda. I mean, I've never been a 1 year old that can swallow anything other than like a smushed banana, right? Great. Yeah, like what's the game plan here? Are you gonna like crush it? What's the plan? Yes. You're right. I love that. I feel like if we were to walk down the road, I don't know, maybe at the airport and be like, name me an antibiotic, everyone's gonna be like, amoxicillin. You're like, nice job. So it's like the go-to, right? But why amoxicillin? Like, how did they come up with that being the right antibiotic for this baby? And how can we really help them? I did the switch thing again. Don't worry, it was on purpose. So when I'm looking at this situation, I'm like, well, what symptoms does this child have, right? Like, what's even going on, right? Can the child swallow a tablet? That'd be pretty impressive. Excuse me, should they see a doctor? Have they seen a doctor? How severe is the infection? How long has it been happening? Have they taken anything prior? How did the mother decide on amoxicillin, just like y'all came up with? So again, if we were in Guatemala, and this is happening right now as we speak, they would give them 3 tablets of amoxicillin, right? So now you can see why antibiotic resistance is shooting through the roof, because we're giving the wrong antibiotics. Sometimes we're giving an antibiotic when they should have never received an antibiotic. We're not giving the right dose. We're not giving the right duration, etc. So although sometimes the laws in the states are a little annoying, this is a good one to have required prescriptions. So these are the things that I'm thinking about when I see this patient. So we did need more information. Now let's pretend now that this patient actually did now go and see a provider. So we said, hey, like your baby's 1, maybe not. You're not able to get the amoxicillin, right? Like maybe you should go see an urgent and go to an urgent care. And we've established that the patient actually has a urinary tract infection. So amoxicillin was never the right drug for the UTI. Instead, a medication like cefadroxil would have been far more appropriate. This is a cephalosporin, far more appropriate for someone with a urinary tract infection, and we were able to put it in a powder, right? This is actually a picture of the exact bottle, not the exact one, but one I found on Google, but the ones that we have in Guatemala, actually, and it comes exactly like this, right? So it's a powder, it's in a box, not brain surgery, etc. But what are you thinking about now? So it's a powder, and this is what we would have just handed to the patient. What are some of the things that are important to think about with this situation? Reconstitute it, right? So really interesting. This actually happened 3 weeks ago when I was in Guatemala. They stopped reconstituting the med in the pharmacy and we're just sending it home like this. Again, it was like a lack of transition, like where that information wasn't passed on to the new person working there. And it's very normal in Guatemala to do that. But also there was a lack of trust because I was like, why are we not reconstituting it? He's like, oh, well, they say they want to do it at home. He's like, I try and tell them like where to fill it up to. And I was like, do you think it's like a water situation? Anyways, long story short, they're essentially bringing it home because oftentimes they're either cutting the powder to save it for another time, or they're wanting to put in more liquid to save it for another time. So again, just pardon me, for another child, yeah, if like the child kind of has a similar situation, in this case, they probably, if they were to have done that, maybe they don't finish the prescription and then the child gets sick again. So they're like, I'm just gonna give them the same thing and then doesn't, it's a perpetual cycle. But anyways, yes, we are thinking about the fact that it's a powder. How do we create that trust that like, hey, in your country, I would have just handed this to you, but we reconstituted it for you. Like, here's the way in which you want to store it. But anything else that's missing here with this medication? How are you going to give it, right? And how much, right? So, yes. How much does the child weigh? Totally. And unfortunately, the individual that's working in the pharmacy who has no pharmacy training is like, and how do I do this math? And I'm like, oh God. But also, if we had the actual appropriate dose for this patient, how are we going to administer it, right? So these are things that you're capable of walking into an environment in an underserved area and saying, wait, so we're just giving them the bottle. What can we do to improve this system? And like, if they get home, how are they going to actually administer it, right? Like, what is the dose to administer? Yes. Yes. Mm-hmm. Really? That's one way to traumatize your child. Yeah, so she had a situation where a child was unable to swallow. They were able to reconstitute it into an injectable, and she's unsure if they take tablets today. Yes. Totally. Right. So it's that patient education piece, right? So he's saying like maybe the mom's like, swig this baby, you'll feel better tomorrow. The whole thing. Maybe not. But it's really, really, really important that education piece is what I'm trying to emphasize with this case is like every time you're giving a prescription to someone, they may not know how to take it. And I can almost guarantee 60% of the time, probably higher, I should have actually got the stat, like they haven't had this conversation with their doctor, right? The doctor's like, take this twice a day, see you, never. So really spending that time to help them to understand, make sure that they know how to store the medication, make sure they understand the dose and how to actually physically administer it. And I think I'm basically probably out of time. So let me just finish by saying there's a lot of ways for you all to get involved in these kind of initiatives, but I would say take your everyday job with a new lens, with that global pharmacy perspective, with that cultural intelligence, and try and see your patients where they're coming from in a manner that you can better support them, because more often than not, they probably don't understand our system because they're coming from a very different system. And yeah, I will be here. My card's over there.